The Institute of Public Health in Ireland, or IPH, promotes cooperation for public health across the island of Ireland. The Health Well is a unique all-island health information website established in 2009, hosted by IPH, that supports evidence-informed decision-making in 3 ways. 1. Provides access to the information you need. 2. Helps you understand and use information effectively. 3. Facilitates you in working collaboratively across the web. The first part of this training video covers accessing information. You can access information in 2 ways, via the Health Well website or the All-Ireland Public Health Repository. Let's start with the Health Well. To help you access the information you need, the Health Well brings together in one place the most up-to-date health information from a wide range of sources. These cover population health as well as health and social care. To view a list of the Health Well's partner websites that regularly contribute their content to the Health Well, hover the mouse over the Supported Websites tab and scroll down to select Partner Websites from the drop-down list that appears. In addition to knowledge resources, the Health Well is also updated daily with health-related news articles and abstracts from a wide range of open access journal publications. Information resources contributed by partner websites and drawn from key health-related websites are structured into catalogues. Search the Information tab from the menu to view the catalogues that are available: interventions, policy, data, evidence, etc. Search the News tab from the menu to view the latest Health Well spotlights, current affairs, other news articles, newsletters, blogs, forums. You can search all of these resources using the search bar in the top right of the page. For example, let's search for obesity. Search results can be easily filtered by using the filter boxes in the right-hand side of the screen. In our example, let's filter by catalogue. Let's select the policy option. You can also organise the search results by relevancy, title, type, author and date. Let's sort by date to get the most recent policy added to the Health Well in relation to obesity. You will see this is A Healthy Weight for Ireland, Obesity Policy and Action Plan 2016 to 2025. All resources on the Health Well have a metadata page which provides information about the resource. You can access the metadata page for any resource by selecting More Details button. Here you will be presented with information about the resource, including the creator, the date of publication, a brief description of the document, etc. Related resources are presented in the block on the right-hand side of the metadata page to help you in your search. To access a resource directly from the search page, select Access Resource button. This redirects you to the contributing website for that particular resource. In our example, this is the Department of Health. The Health Well website contains a number of thematic subsites or hubs that focus on particular health and social care priorities. In these hubs you will find details of the latest research, government policies, interventions and what's happening in this area. To view the hubs, hover the mouse over the Hubs tab in the menu. Currently there are 4 hubs on the Health Well. These include obesity, chronic conditions, fuel poverty, health inequalities. There are also a number of smaller pages that focus on mental health and rare diseases. You can keep up to date about new information added to the Health Well by signing up to IPH Open Access Research Alerts. Hover over the Information Resources tab, select IPH Open Access Research Alerts from the drop-down list that appears and follow the instructions given. You can also follow @the Health Well on Twitter, and there's also a Twitter account for each of the individual hubs. Social media tools such as Facebook and Twitter can also be used to share information resources on the website. Now let's look at the All-Ireland Public Health Repository. You can access the All-Ireland Public Health Repository by selecting the Repository tab from the menu. The repository is an open access initiative, OAI compliant repository. That is, it provides immediate online free access to research outputs. The repository increases access to information in 2 ways. 1. It provides users with access to a broader range of open access resources from RIAN, the Irish Research Repository, and OpenAIR, the Repository of European Research. 2. It increases the discoverability of the Health Well's contributing partner websites resources on open access portals. The second part of this video covers the Health Well's exploratory tools. The Health Well has a range of exploratory tools. They allow you to work with the most up-to-date health information and data and can be accessed by hovering the mouse over the Exploratory Tools tab where a drop-down list appears. The IPH Community Profiles tool is an online tool that uses geographical information systems that helps you access, understand and use local health and social care data by creating health and well-being profiles of your area. Use the data visualizer for more exploratory work of the data tables contained on the Health Well. The Chronic Conditions Prevalence tool allows you to 1. Access IPH's published prevalence estimates and forecasts for diabetes, stroke, hypertension, CHD, chronic airflow obstruction and musculoskeletal conditions. 2. Calculate prevalence estimates. And 3. Explore what-if scenarios based on theoretical changes in the demographic profile or relevant lifestyle behaviours of a population. Public Health Information System, or FIS, data tables are produced by the Department of Health from Ireland's National Health Information Systems such as the Central Statistics Office and the National Cancer Registry. Tables are grouped into themes: cancer, demography, fertility, hospital discharges, mortality and psychiatric. They are a useful resource for the measurement of population health, target setting and evaluation, and evidence-based service planning and policy formulation at both national and regional levels. Use the Physical Activity and Nutrition Intervention PANI tool to critically compare interventions from across the island of Ireland and the UK. The PANI tool helps users to clarify the objectives of listed interventions and/or their own interventions, brings together relevant evidence, policy and international initiatives, gathers together details of relevant interventions, provides an interface to identify alternative interventions that warrant further consideration, and helps you learn what other people are doing, encouraging collaboration and building networks. The third and final part of this training video looks at how the Health Well helps users to work collaboratively across the web. The Health Well hosts a number of websites. Hover the mouse over supported websites to see a drop-down list of these. The Health Well also supports web groups, providing a digital habitat for communities of interest. Web groups have their own secure sub-sites that include discussion forums, event calendars, collaborative authoring tools and more. Under the Events tab, select All Events to access details of presentations and audio from all past Health Well and IPH events. The Health Well is free to use. You can create a free user account called a MyWell account. The additional benefits of a MyWell account include creating a user profile, saving search results, reading a citation list, saving outputs of interactive tools, customizing your view of the Health Well. We also offer free practical online training on the Health Well website and its interactive tools. Just go to the Home tab and select Training from the drop-down list that appears for further information. You can access the Health Well on www.thehealthwell.info or follow @thehealthwell on Twitter. If you want to contact us, you can email info@thehealthwell.info.
The Institute of Public Health in Ireland, or IPH, promotes cooperation for public health across the island of Ireland. The Health Well is an all-island health information website hosted by IPH that supports evidence-informed decision-making. One of the exploratory tools on the Health Well website is the IPH Community Profiles tool. This can be accessed from the main homepage or any point on the Health Well via the Exploratory Tools drop-down menu, or directly from the web address iphcommunityprofiles.com. You can also download the IPH Community Profiles tool as an app from the Apple Store or Google Play Store. There are a number of ways you can start the tool from the homepage. You can select the geography you want to view: All Ireland, Republic of Ireland or Northern Ireland. You can explore the indicators using the range of tab functions on the top right of the screen: View Indicator, Compare Indicators, View Area, Compare Areas. You can also use the search feature to search for an indicator or theme you're interested in. Let's start the tool by using the View Indicator tab. By default, the tool navigates to All Ireland indicators and to the first indicator on the list, rate of infant mortality. You are presented with a number of components on the page: a map showing the value of the indicator for each area, a bar chart and a line chart also showing these values. This is the basic or default view. You can also toggle to the advanced view, which is more sophisticated charts, in this case funnel plots, as well as having the map and table components. You can view the data in a table by using the Map Table toggle feature. Many of the indicators are available for multiple years, and in this example for infant mortality there are 7 years of data available. You can select different years at the bottom of the map to view the data for that year. You can also use the play button to view an animated version of the time series. You can focus on one or more specific areas you're interested in by selecting these areas on the map. If you then click on Zoom Map to Selections, the other components on the page will also display your chosen areas. Re-click on Zoom Map to Selections to cancel your selections, and all areas will be visible again. After generating a map, table or chart of the indicators of interest, you can export these components for use in reports and presentations by clicking on the down arrow feature. To explore a different indicator, click on the Select Indicator button above the map and choose your desired indicator from the drop-down list that appears. If you want to explore a different geography, click on the Select Geography button also above the map and select your geography of interest. To find out more information about each indicator, click on the Metadata button on the top right of the screen. Metadata is detailed information about the source of the data and how the indicator was arrived at. To help you put the data into context, you can view related public health resources on the HealthWell website by clicking on the Related Public Health Resources button on the top right of the page. The Help button, also at the top right of the screen, provides more information on the features and functions of the tool. Let's compare indicators. You can compare indicators by selecting the Compare Indicators tab on the top right of the toolbar. This is useful when you want to compare any two indicators directly. The process is the same as we described previously for View Indicator, except now you are working with two indicators. For example, under the obesity theme, you might want to compare the prevalence of obesity with the percentage of people who are physically inactive. The advanced view contains a range of charts, such as bubble plots, scatter charts, and polygon maps, for further analysis. Let's create a profile of an area. If you want to create a profile for a particular area based on a range of indicators, select the View Area tab on the top right of the toolbar. This view allows you to focus on all indicators for a specific area under a particular theme. The themes and indicators are displayed in a spine chart that presents the area-based indicators as a profile and shows statistical significance of variation where possible. Click on a theme name to see the indicators within that theme. The default area is Dublin City. Choose the area you want to look at from the map, and the components will change accordingly. To map a particular indicator or show it in the line chart, click on your chosen indicator from the spine chart. Let's create a profile to compare areas. If you want to compare more than one area for a range of indicators, select the Compare Areas tab on the top right of the toolbar. The themes and indicators are presented in a spine chart that shows at a glance how one area compares with other areas across a range of indicators and shows statistical significance of variation where possible. Click on a theme name to see the indicators within that theme. The default area is Dublin City. Choose the areas you want to look at from the map, and the components will change accordingly. To remove an area from the spine chart, simply click on the area in the map. To map a particular indicator or show it in the line chart, click on the indicator name in the spine chart. We hope you have found this video about the IPH Community Profiles tool informative and that you find the tool useful in your work. If you require further assistance, please email us at info@thehealthwell.info.